I'm going to drink squash out of a pint glass, so we're fine.
Okay. Good.
Hello. We are live. Sorry, we are just a little bit late. I'll let Amy explain the reason in a bit. It's quite a good one. But I'm looking forward to this opportunity to speak to somebody which has been in this wellbeing industry for a very, very long time, and has lots of experience and knowledge and insight into wellbeing in the workplace and mental health strategy, etc., etc. So before I get Amy to introduce herself, I'm just going to quickly introduce me, just in case you don't know who I am. If you've joined because Amy's doing this, it's been fantastic. So me, I'm Richard Turner. I'm the founder of Employees Health. Employees Health is a workplace wellbeing and coaching company. We help workplaces by supporting their wellbeing strategy through workshops, activities, coaching, but we also run and have a wellbeing and performance program for employees, but we also do senior leader, middle management, executive coaching to help them manage not only their performance and overcome challenges, but also reduce the risk of burnout. So yeah, that's me. If you want to find out more, just drop me a line. We'll have a meeting. Anyway, the boring sales pitch is done. Let's get that out of the way. Amy, thank you for joining me. Please, first off, say hello.
Hello, everyone.
Secondly, tell me a bit more about yourself. Tell me, don't go into too much detail because I feel sure we will go into that in the next part.
My name's Amy McKeown. As Richard said, I'm a kind of dinosaur in the mental health and wellbeing industry, having been in it for, I guess, 20 years now. Kind of by mistake, fell into it because I grew up in a psychiatric family, which was quite involved in workplace health before it really existed. So I've been around the block a long time.
Nice. I didn't say dino, just getting it out there. I don't want to get told off for calling you old, Amy.
Yeah. One of the reasons I'm a few minutes late was I was having to do my hair because I've been catching up on newsletters this morning, and I was like, I have to hide the greys before I come on.
What about looking good for socials, right? Love it. Hello, Sarah. I knew Sarah would join this. I know Sarah loves you.
I love you too. Sarah, you're my heart.
If you are joining us and you are here, please say hello. If you have any questions or have any input or anything you want to add to the messages, and please do. I'll try and bring them up. So let's dive into your 20 years, as you said, 20 years experience into the workplace wellbeing. So can you just walk us through that journey for a couple of minutes?
Yeah, I mean, like I said, it was a completely accidental, not strategic career move at all. Hi, Claire. I grew up in a psychiatric family. So my father was up in Manchester, and he opened the Altrincham Priory Hospital up there. So I grew up in a psychiatric family with my father, medical director of a private psychiatric hospital. He specialized in stress, anxiety, and depression in the sort of 80s, which is when it really wasn't trendy at all, as a psychiatrist, and always had a patient practice of that. But he was quite an interesting guy. He ended up Bupa's psychiatric advisor, which is how I ended up with so much knowledge and skills around providers and health insurance. But as a teenager, he got an honorary degree for putting in mental health support at AstraZeneca. So while I was sort of growing up and sort of around doing A levels and things, this is what we talked about. And workplace mental health, he was working with Richard Herron and Paul Litchfield not Paul wasn't at AstraZeneca, but Richard was very early on in Richard's career. And my dad was also president of the International Stress Management Association with Kerry Cooper, Professor Sir Kerry Cooper. So this was, he was really at the start of it. And I was really interested. I came down to uni in London and I did a degree called Human Sciences, which is sort of the only degree like it in the UK, multidisciplinary. You did kind of first year medicine, but then you could make up your own degree. So I did a lot of occupational psychology, clinical psychology, business, and then IT. And this is IT in the days where CD-ROMs were high tech, right? And my father had created, with a psychologist up in Manchester, a CD-ROM, which he was handing out to senior leaders at AstraZeneca who'd been on his workshops. So it was kind of like, I imagine what Unmind or what these tools are now, but this was a CD-ROM in the 90s. And being based in London, because I was at UCL, I got involved in a project in the government where my dad sent me along with his CD-ROM to represent him and Lawrence at a project. I don't think I've ever told this one anyone before, actually, where the government bought part of his CD-ROM and part of what is now Beating the Blues or Silver Cloud and part of the other one to put into government centres. So I spent a kind of chunk of time working with very senior academics with these CD-ROMs. They were all bickering and fighting, which then led to me working one summer at the West London Mental Health Care Trust, doing the randomised controlled trials that tested online tools, which form the basis of the current NICE step care pathways for depression. So that's a sort of long story. But long story short, I left university having done this and realised that I wanted to work in house mental health and wellbeing at work. But that didn't exist. It was either NHS graduate scheme or hospital management. And so I asked my dad for the rights of the CD-ROM for 6 months, thinking, well, nothing gained, nothing ventured. And I was up in Manchester. So I went to see Kellogg's and who else, like big employers in Manchester, to see if they would buy this CD-ROM and put it on. And long story short, they wouldn't. But I got approached by Cardiff University's occupational health department, who were going to buy Kerry Cooper's product, but got messed around by Robertson Cooper, to my credit. So ended up being my first client. So I moved online from a CD-ROM online and then spent a chunk of time putting this thing online at the university, but then working with them to write their whole organisational health and mental health strategy around it, which then led to other clients such as David Powers Police Force and Oxford Universities. It was basically large public sector in those days because private sector weren't interested. I mean, using stress in those days in an organisation was enough to get you kicked out of a boardroom, let alone anything else. So that was it. That was sort of like 2003 we incorporated. I went off and did a part-time master's in health informatics and health data, and I used the dissertation on that to do a real clinical evidence base of my tool. We did a systematic review of all the literature on preventative digital depression treatment. But in the David Powers Police Force, in the call centre there, we did a proper randomised, well, it wasn't randomised because they were using it or not, but to get the clinical effectiveness and the clinical impact of use of this preventative CCBT tool in, across a couple of hundred people in the control centre. Mm-hmm. So it was sort of 20s, and this is before Facebook or VCs or funding or seed funding or any of the things you can get now. And then I'd realized by about 2007, so I'd been doing this for 4 or 5 years and had been laughed out of pretty much every boardroom in the city, made some inroads in the public sector. I was trying to sell this tool to Bupa, AXA and Aviva. Mm-hmm. And then 2008 hit, the recession hit, everyone panicked. And suddenly Ernst & Young came along because my master's, I'd got hi everyone, it's nice to see you. I'd got a master's in digital health or health informatics and use of health data from UCL, which had won an industry award. And so I got contacted by Ernst & Young to come and work in their digital health team. So given that I was struggling to sell my business and we were in a major recession, and by this point I was 30, I thought, well, probably a good place to ride out the recession. So I ended up at Ernst & Young. When I was at Ernst & Young, I ended up setting up, based on this decade's worth of experience, their mental health network, which I grew from 1 person to 500 people by the time I left. And there was a representative in each of our 22 offices in the UK. But I used my role on that and my decade's worth of experience to poke about at Ernst & Young on what I thought needed to be done. And in those days, organizational health and mental health strategies didn't really exist. No one was talking mental health. So I wrote this strategy, which I took to the UK advisory chair, who took to the UK chairman. And long story short, I then got seconded down to the employee relations team in HR to then get this strategy up and running, which was fascinating. It was taking a piece of paper and getting it live across 14,500 people in the UK. So really, that was great. And we were the first, apart from Unilever, the first large organization to roll out mental health first aid, with a massive caveat in that I'd put in really clear care pathways and providers and stuff. So we had bespoke the mental health first aid to signpost to them, which is why I then ended up on the mental health first aid board as their NED in charge of workplace, because we were their first workplace client. So So yeah, that was the large organizational stuff. Yeah. And then ended up, I mean, varying people know, leaving Ernst & Young in between my children. And since then, I've been independent. My first client as an independent was Burberry. So a FTSE 100's global strategy, which was fascinating, how you can make something fit across 27 countries. My second big client was the EU Parliament. Again, really interesting organization. But I work with, some of my clients are 10, 15 people in an organization. And then sort of last year, when I was looking at how I work, I love large organizations or organizational consultancy, and I think I'm really good at that. But I also wanted to build into my career teaching, learning, working with individuals. So that's why I now run a mentorship and run a training course, which takes a very practical, my knowledge and skills of what I've done sort of practically. And then I run that a couple of times a year. So sort of blend of different things really, but bringing in that kind of experience of being a health provider, being a senior lead in-house, being a consultant, but also my own personal experience of being through occupational health, because I think that gives me a unique place in the industry, and that I've actually done all four of those different viewpoints.
Yeah, I mean, it's quite an impressive resume within the world of workplace wellbeing, right? And then I think when you're looking at it, understanding wellbeing within an organization, and let's say we look at, we're obviously both providers, so we speak to a lot of people, and then you look at companies. When companies I'm looking for, kind of your medium size, I don't know, up to 500. Sometimes you get 1,000, sometimes you get 2,000. But when you're talking about mental health and wellbeing strategies, large scale, 27 different countries, over 10, 100 or 50,000 people.
Well, Burberry is quite small as an organization. It's FTSE 100, but it's quite small as a workforce, a few thousand. But the interesting thing about that as an organization, it's a few thousand spread across 27 different countries. And in one country, you might only have 4 or 5 people, which is a Burberry shop. But also what was interesting about that as a client is that there was very different workforces. So Burberry does all their own manufacturing. So you've got manufacturing, you've got 1,000 people in head office, most of the employees at retail, but then you've got your design team. So you've got very, very different workforces in very different countries, in very different skills. So it's how you can create a structure that you then weave into an organization that's then localized. It was the key there.
Yeah, I just think I mean, I think there's a lot of things that come up as a challenge, I can imagine, and thinking about strategy from different angles, as you said, different cultures, different job design, different countries, and then you got your vast amount. So I can imagine over this kind of period, you've learned quite a lot. I'm looking forward to kind of hearing some of your advice when it comes to kind of creating wellbeing strategies and mental health. But we'll do that a little bit later on. The next bit I kind of wanted to speak to you about you've seen 20 years worth of evolution in mental health and well-being from very different angles. Where do you see well-being and mental health now?
Now this is a good question, because I have just written in my newsletter. So if you're not on my newsletter list, get yourself on it. It's on LinkedIn. That's a bit of a plug. But I literally just answered this question because I was writing where I see the industry now, and where I see it going in the future, which I'm going to put out now, but also in September. So I'll start with September, right? Because I think September is interesting. I'm going to be doing a lot of LinkedIn stuff in September, but what I'm going to be doing, and this is an answer to your question, it's not a shameless plug, although you might interpret it as so. 5 years ago,
it's marketing anyway.
Well, so 5 years ago, I started putting out posts on LinkedIn. So when I came out, having had Bear, my little boy, who's now 5, wellbeing had exploded, and there was 1 million people talking all over LinkedIn about wellbeing and mental health and lived experience. So my, as a mum with 2 kids coming back into the workforce, I was like, how am I going to compete with that? And my decision was to, put together very short films on the practical skills of health and mental health, because everybody was talking lived experience. So I thought, well, actually, I will put in some of my actual experience of putting things into, and do series of videos on LinkedIn, which I'm in the process of just tweaking from my website and stuff. And that's what got me all my clients, by the way. I don't ever really look for work. It sort of finds me through that content on LinkedIn. But the reason I say this is in September, I'm going to be starting to repost the exact same videos that I posted 5 years ago on a Monday, and then on Wednesday putting a comment on where we've evolved. And the honest truth is not really. Like the first one that I'm posting is about, beware the mental health expert. The next one is should HR lead mental health and well-being. The next one is about the provider landscape. So stuff that we've been talking about for 5 years has evolved a little bit, but not really, right? So what I would say about my choice of career to anybody coming into this space is don't do it.
We're both on the same line.
20 years and so much grey hair later, this is an industry, if you can call it that, that is glacial, right? Like glacial paced, I was gobsmacked when I saw the likes of the Unminds and these sorts of tools coming out, because I was like, well, this is what I did in 2003. But what I have realized, A, I'm usually ahead of the curve, but B, this is a very, very, very slow moving space, right? In 2008, 2009, organizations were not using the word stress. Mental health then exploded about 2015, 2016, where everyone was talking about mental health. But where we are now is people are a bit fed up of that. I think, this is obviously my view. I see a lot of people in our industry, if you could call it an industry, and I'm not meaning that in a facetious way, I'm just meaning where we are now. There are a lot of redundancies. Most of the wellbeing leads I'm working with are in jobs that they're clinging onto with their teeth and having budgets pulled. There are lots that are taking voluntary redundancy. There are people who have had really good jobs in our industry who have been looking for jobs for a while. And so far in 2023, I've not seen any jobs at a senior or strategic level really come up. And the jobs that are coming up tend to be junior lead role jobs that want insane amount of experience and knowledge for peanuts of a salary. Yeah. And I mean, if I'm going to be really blunt, I probably wouldn't get most of them, because despite 20 years experience, they now require all of these qualifications and pieces of paper that I don't have, that actually are completely irrelevant, I think, in a lot of cases, to being able to do a good job. So we're in a really interesting point. I think 3 years on from the pandemic, organizations were piling into this 2020 to look after staff. You saw Zoom today talking about people coming back out of the home into the workplace. We're at a really interesting point, and we're at a really exciting point, right? So we're at a really interesting point in that nobody knows how to work anymore. No one knows how to live anymore. Like the world is a sort of like doom and disaster and crises of everything, right? If we're not going to be dead from climate change, we're going to be blown up by a nuclear bomb or the Ukraine war, or starve to death because of our inflation. So, I mean, we're at that point. So we've kind of forgotten how to live and how to work, and no one really knows. And in amongst that, there's this weird thing in the well-being industry where everyone's carrying on as normal and organizations are cutting. But at the same time, we've got more people out of the workforce than ever before, with ill health and an NHS that's imploding. So what I put earlier,
rising consistently, overwhelm is rising consistently.
Yeah. So where we are is we're in the eye of the storm. We've been here a while. We are still in cloud cuckoo land, where we're pretending this doesn't matter and that we can carry on as we are. But I think the next 2 years are going to be interesting. I think for the industry, the mental health and wellbeing industry, and this is something else I put in my newsletter, so another shameless plug, but I was talking about why I'm going to be using the word wellbeing less. And the reason I'm going to be personally using the word wellbeing less is that my career trajectory has focused around health and mental health and working with HR and occupational health and health providers. Kind of wellbeing was this sort of thing that exploded 5 years ago that people don't really know what it means as such. So I think focusing on health and mental health and how to look after the health and mental health of staff, and of how we're going to pay for healthcare and mental health care as a society, is really where this is going to go. And you're seeing, I've been doing quite a lot of work with boards this year. You're seeing an influx of regulation, of Australia brought in psychosocial risk assessments 45003. We've got the CCLA mental health benchmark, which is great. The government procurement social value model now has mental health coming in. So we're at kind of the eye at the storm, where I think the industry is taking an inflection from the explosion a few years ago and figuring out what well-being is and what works and what doesn't work. And some people will sadly leave, other people will go off and do other things because they'll realize that they can't live on beans forever. And some of the things that will work will then kind of be developed more and more.
Yeah, I kind of agree with you. I mean, there's so much to unpack there. The thing I see from my side is it seems very topical. I think you're very correct. We are in this eye of the storm. We don't really know, and nobody really knows where this is going. And as you said, jobs are everywhere. It also seems very topical. I think when we look back at COVID, it was very much around mental health. Then it went into loneliness. Then it went into, now it's financial well-being. So rather than just embedding kind of people-centric well-being and a positive lifestyle and health being the most important part for performance for a company, then I feel like that's where we are at the moment. Like it's a weird place for us to be in.
Well, we've always been moving, right? So when I first started out in 2003, I mean, I'm not even going to ask you how old you were then, Richard, but everyone was sat on Swiss balls. You know, the Swiss balls? I sat on giving birth to my daughter for a while, but these Swiss balls, everyone was sat on Swiss balls, and organizational well-being was about getting your organization to buy you a Swiss ball. And then it was a stand-up desk, then it was a treadmill desk, then it was a Garmin. Like we did at Ernst & Young, we were under relentless pressure to give everyone Fitbits. So we actually did a trial in one of our teams to see if it had any clinical impact. And guess what? After 6 months, most of them were lost or in a desk drawer. But so well-being in the physical world had always been whatever the next fad was. And in the mental health world, it was the same. So it was stress, and then the stress industry is now the well-being industry, right? But stress then became resilience. We then went through the corporate athlete. We then went through energy. We then went on to mindfulness, which stuck around for ages, and then sort of mental health. But we're not really talking about mental health. When we're talking about mental health, we're talking about mental illness. And then, as you said, we kind of moved on to performance again, because, what better way to run an organization than to talk about performance? And now we're talking about, because of COVID, because of the financial crisis, financial well-being, all of which are really important, right? So I'm not trying to undermine those. I mean, personally, I don't think sitting on a Swiss ball is that important, but like in the mental health world, we should be talking about those things. But what happens is that people jump on the next fad to rebrand what they've done and try to sell to HR. And this is why HR and organizations are getting tired of just being approached by wellbeing providers, because we've got to a point where so much has come in. How can you actually prove that it's going to do what it says? Yeah,
for sure. Completely agree. And yeah, as you said, there is so much, and people are being bombarded by all of us.
We missed out menopause. Maybe it doesn't apply to either of us. Well, I'm kind of heading my way there, but we missed out menopause. That was the.
It's not on my radar at the moment. Give me a couple of years.
Well, I'm kind of going there now. Like 43, it's a slippery slope.
I mean, it is a weird. We're in a weird space, and I'm kind of similar to you, as you said earlier on. You're changing your rhetoric, and you're changing your story, and moving away from the term well-being. I'm finding now that because of my physical health background, and obviously entering the well-being world. I mean, in terms of how long you've been in there, very like recently. And the impact, I suppose, because of the qualifications of coaching and the other bits and pieces that I'm moving to, as you said, that term performance. Just because I feel like companies are buying into the term performance, but it's not much difference from the rest of the terms we've used for well-being in regards to that. It's all about lifestyles, right? Decisions you make, mindset you have, the activities you take, the habits you perform every single day. Implement those good bits, and your performance increases. And so it's interesting what kind of angles we're having to take just to stand out and be a bit different, right?
Well, performance performance is what organizations do, right? So performance is, organizations, I'm talking private sector, not public sector, about money, right? Money and performance, right? So at Ernst & Young, if I wanted to get a man in the room, right, I would have a mental health speaker that was talking about performance. So, for example, if I got John Amici, who I had in a few times, he is an absolute legend, John Amici. Room would be packed with men. I got Steve Peters in from the Chimp Paradox, Team Sky, talking about performance. You couldn't move, right? If I got someone in talking about something else on mental health, empty, right? Well, not empty, but people who were interested in mental health. And I made a point of doing so. But yeah, like people always want to perform better, do better at their jobs. Organizations want to earn more money. That's what it's about, right? So that's how we've shaped society, though, right? We have expected health and mental health, right? Which is something I grew up in a doctor's family, right? There was never that expectation that you would be healthy or mentally healthy. And even 2 generations ago, there wasn't this expectation that, you would live healthily and that it would just be about performance. But it makes sense if you're working with an organization to use their language. And it makes sense for, everybody wants to be a better this, a faster this, a more productive this, a wealthier this. So, labeling it as performance is just whatever the language works. Yeah.
And I feel like it's the UK in general, right? It is our culture, and it's becoming an unhealthy culture of that. We have to push and compete consistently. When we look at, I always look at Australia as the flip, in regards to how they live their lifestyles. In regards to,
are you kidding me, right? Look, my partner's a Kiwi, right? So as is the wonderful Sarah who's on, right? You're talking about a very masculine Australian sports culture, right? So performance, like capitalism is money performance.
Yeah, I don't mean performance. I mean
sporting, look.
Yeah, performance in a different angle, from a different angle, though. And I suppose being a man who loves sport, that's why I resonate with the Australian lifestyle, being outside.
Hopefully not their cricket team, because their cricket team is sport gone mad. Sorry if there are any Australians on here. There's a balance between that. Do you know, last night I was stood out in the street with my partner, who I've been with 10 years, right? Who's Kiwi. My kids are both got New Zealand citizenship, and he was playing with a rugby ball, right? And he threw it to me because I bet you can't catch that. So I caught it and then threw it back to him, and he's like, "Oh my God, you can throw a rugby ball." And I was like, "Yeah." And he's like, and I said, "Look, dude, the rugby club at the end of my road in Manchester," I said, "I was the only girl that played there for 2 years. I used to go down when I was 13, 14 and play with all of the lads." Because, "Well, have I been with you for 10 years and you didn't tell me you could throw a rugby ball?" And I was like, because A, I don't need to compete, but B, never show all your skills to people, It's
even your husband, your Kiwi husband.
Because I've just spent the last half hour teaching Ivy, and then Ivy, my 9-year-old, came running up after this. She goes, "Daddy says you can throw a rugby ball." And I was like, "Geez, seriously?" Kind of like, this is blokes for you, It's like that. But no, for about 2 years, I was the only girl that went down to play rugby with all the boys. And I was on the wing. No guy would tackle me. And then what happened?
Top scorer.
And then what happened was puberty happened. All the guys suddenly got very big, and by this point they'd all figured out they could tackle me, and so that was the time to drift off, right? But yeah, it's like it's a very narrow view of performance, though, right? Sport, sport and business are both very narrow views of performance. But you also made a really interesting comment about in the UK. The thing about the UK, and this is where Wellbeing will go in the next 5 to 10 years, is that we focus on performance, but we don't focus on health or mental health or personal responsibility. And the reason for that is we've all grown up with the NHS. So we've all grown up with this expectation that actually, if we are unwell, there is a free service that's there going to pick us up, right? So we don't have to look after our own health and mental health or take responsibility for it, because we can just nip off to the GP or whatever, or have hips done and knees done and things like that. And that is a social contract that has broken, right? And actually, we look at health and mental health like it's a nice thing to do for performance. We actually forget that we have to take responsibility for our own health and mental health, not just for performance, but for actually a healthy lifestyle and enjoyment in life. We were brought up with this fallacy that healthcare is free, and that our health and our well-being is somebody else's responsibility, because we can drink ourselves to death and smoke ourselves to death and eat a really unhealthy diet. But we've got this magical thing called the NHS that we don't pay enough money for, that will pick up the pieces,
Yeah, I'll be 100% with you there. Obviously, one of the bits I talk about with as a personal trainer and as a health specialist, it is that, isn't it? It's a responsibility to yourself. And you make a really good point. I suppose I probably missed that a little bit. Is that actually we have expected our health to be looked after, and rather than actually putting the onus on ourselves to do some hard work, just make sure that we are living healthier lifestyles.
Yeah, and whenever the NHS is mentioned or paying £5 to go and see a GP is mentioned, there's like national outrage. And actually, that's because we've been living and are living in cloud cuckoo land about how expensive healthcare is. Because it was sold to us in 1948 that if we pay for this, the original concept of the NHS was that if we pay as a society up front now, then we'll be healthier and therefore it will cost less later. What has happened is there are more of us, populations have grown, we're living longer, and we're living with far more chronic and long-term illnesses. So actually we have a system that we don't pay for that doesn't work. And you can see that now, and you can see that in the amount of ill health. So it's a really interesting point, both from a personal level and from an organizational level, in that I think that the sort of nice chat about well-being that I see in organizations sometimes is instead of a really honest discussion about how to look after the health and mental health of employees, how to stop people getting sick, how to challenge GP sick notes, how to manage people when they're off, how to give them reasonable adjustments. It's all it's a bit easier and nicer to do sort of fluffy well-being things that make everyone feel good, but we're not yet having an honest conversation. I mean, one of the easiest things to get a decent return on investment from, and one of the most underutilized tools in most organizations, is occupational health. Right, because with a decent occupational health department and care pathway, you can manage people in the workplace rather than them being off sick, or if they are off sick, manage their illness and return to work much quicker. But yet, so often, whenever I go to an organization, usually the first question I ask is, why aren't you using your occupational health properly? And that's because I think most people don't understand it.
Yeah, I think it's spot on. I was going to ask you what your tip would have been, and I think that's answered it very well. And I think they are underutilized. And I also misunderstood maybe as well.
Yeah, it's interesting. I was talking to Nick Powell from the Society of Occupational Medicine about that, because I don't think occupational health have done a great job of actually talking about who they are and what they have to offer. But that said, I think organization, some occupational health providers aren't very good. A lot of them aren't set up properly, but a lot of people, if you look, and this is a fundamental problem with health and mental health in organizations that's shifting slowly, but not that fast, is if you look at who's buying occupational health or health providers for an organization, it's usually someone from HR, someone from reward and benefit, and someone from procurement. Nobody with any real clinical skill or knowledge or awareness of these products, because being an HR person means that you're amazing at HR policy and process. Doesn't mean you know what to challenge a health provider on or how to set up an occupational health department, probably.
Yeah, for sure. It's interesting. I mean, that's probably another topic, and maybe we should catch up, and I'll see if I can introduce me to an occupational health person to come on and do this talk.
Sure. I'm sure Nick Powell will come on and talk to you about it, because I had this very conversation with him. And actually, like I said, he asked me to do a blog on occupational health earlier this year that normally I can knock out a blog in a week. It took me a couple of months. And the reason it took me a couple of months is I realized that all of my first clients with Xanthus were occupational health. And one of the first things we did at Ernst & Young was re-procure the occupational health and stuff. So I realized that actually a lot of my work is more around health, mental health, occupational health, and prevention of illness than it is well-being. Well-being just seemed an easy term because everyone else was using it.
Yeah. And that's why I can see why you've made that shift across.
Yeah.
Okay, so I think we went on a couple of tangents, which I love. And this podcast is all about a good tangent. We're going to bring it back. And so I've got two sections I want to talk about. One, which is around kind of what organizations need to be doing now to improve and be better. What do you see? As you said, you talked about kind of your vision for 5 years and what companies should be doing. So let's look at that first. So from your view, from what you're seeing at the moment, and obviously all the experience you've got, what companies right now need to be doing to make sure they're looking after their people better?
Well, I guess it depends on where an organization's at, right? So when I work with organizations, just because of the very nature of what I do, they tend to be the progressive ones and the ones who are ahead of the curve, right? So they tend to be organizations that either are starting out doing this and want to do it properly, or my most common type of client is they've done quite a few things, they've sprinkled some mental health first aid around, they've put some things in and nothing's really working, so they want to do it strategically. There's still fewer and far between than you think. It's still quite easy to have a well-being lead that you don't give much power to, that you talk a good game, and that you're doing a lot of training. So there's a lot of training going on, which is great. I think we're running a bit dry on that, right? So I think it's, again, looking at for your organization what the problems are, if any. I mean, there's a lot of talk about psychosocial risk assessments now. That's one way of preventing. But I think looking at that and then looking at what you're trying to achieve, right? And why. Because a lot of when I speak to organizations, they've started doing stuff. And there's generally, we're doing this to raise awareness and reduce stigma of mental health, blah, 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 sort of chats. But then when we unpick that, they're just doing stuff because they feel they should be. They're not really clear on what they're doing or why or what the goal is. So I think it's actually dialing back as to what that is and making sure the basics are in place. So when I say the basics are in place, you've often got a well-being lead, or potentially got a well-being lead that's running out training, and there's mental health awareness training. But the basics in place is that there's not a really clear structure around prevention, and then absence, and then how to manage absence, and line manager responsibility around absence, and reasonable adjustments. And where I see a lot of organizations very exposed now is that organizations have run into peer support, mental health first aid, mental health awareness. It's just all we need to do is talk about it, which is good because I'm all for reducing stigma. But if I have sent you, Richard, on a mental health awareness course, and I've given you some peer support role in the organization, there needs to be some governance and boundaries around it. Because if I came to you as your peer and I said, I've got depression, I've had it a long time, I have, even though it's an unofficial role, told somebody in the organization that I have a long-term mental health illness, which is legally a disability under the Equality Act. So I see lots of organizations who've done this sort of awareness raising and this, we need to talk about it, and we've got these informal peer supports, but actually leaving themselves widely exposed, because if an employee tells another employee they've got a long-term illness or a chronic illness, then that is actually, there's a legal responsibility about that in terms of disability and reasonable adjustments. And most organizations have done zero governance and boundaries about that, right? So when I say, like, it's like, for me, it's always, what are you trying to do? Why are you trying to achieve it? How will we know whether you've achieved it? And what are the basic structures that we need to be put in place in terms of policy, process, roles and responsibilities, performance management, but also legal? Because I think most organizations are now massively legally exposed because of the ploughing into mental health and mental illness chat without any of the structures underneath.
Yeah, so build structure first.
Yeah, well, before you build structure, figure out what you're trying to do and why, because that's often building awareness is a worthy goal, but how will you know when you've achieved it? What does it mean?
Yeah.
And also, a lot of organizations I see, and I'm talking mental health, mental illness as opposed to physical health, are talking about looking after the mental illness of people that are already in the organization. They're not necessarily making themselves better employers of people with mental illness in society. There's still that barrier to work for lots of organizations, for lots of people who have mental illness to get in the first place.
Yeah, it's quite a lot to think about there, right? And for an organization to put into place and manage.
Well, that's why start small. So, you start small with your what are we trying to achieve and why, and then some very clear definitions of what that is and what mental health or illness or well-being is to that organization.
Mm-hmm.
And then what that means. And then, I spend at least a year or two doing this with organizations before we then build. You need a backbone, and that backbone needs to be very clear definitions and frameworks, policies, roles and responsibilities, learning and development, structure, right? And then you build out from there. What happens is often it's, yay, menopause is huge. Let's do something on menopause. And then 5 minutes later, yay, let's do something on this. And it's like you're bringing in initiative after initiative after initiative, which is fine if you've got a structure and backbone, but it's often at the expense of governance, roles, responsibilities. And I'm very concerned about how much pressure is being put on line managers right now, because line managers have now suddenly been moved into a very much more pastoral care role since the pandemic, but also lots of organizations have moved into hybrid working. But yet, if you look and speak to them about how they're training people, what soft skills they're giving managers, how they're training managers to manage and lead in a hybrid setting, that's not happening. We've got the policy, but we've not actually changed the work. So that's why I'm a great believer in slow, steady, thought through strategic change that you can build on over time than sort of like the next shiny new toy. But unfortunately, the next shiny new toy is often a quick win.
Yeah, and also people don't want slow. People want quick wins, as you said, or it's people don't want to pay for the slow because the slow costs money. And
everything costs money.
We both know there's no investment in wellbeing right now, right? And so I think it's even harder.
Yes, but this is where the biggest fallacy around well-being ever existed is, which is that organizations don't want to pay for it, but they are paying for it, right?
Oh, yeah.
So what they're thinking of as well-being is, most organizations don't track absence properly, and they certainly don't quantify it. But I have not worked in an organization yet in 20 years that we haven't managed to guesstimate it with some very good stuff. So, for example, if you're in professional services, we use timesheets, right? So actually, every organization is already spending money on this stuff, right? It's about stop thinking about creating a well-being lead and buying, services and having a well-being budget. If you start thinking about this is how much money we're already spending in terms of absence and retention and providers that aren't doing very much, why don't we strategically reallocate this into something that's going to work over the longer term? That's a much more helpful conversation to have with an organization, which is rather than finding new money, this is money that's not strategic. But that gets over the UK problem, which is that we don't think about paying for healthcare. Right? We just don't. So this is it. We just don't think about it. Yeah, exactly. Sarah's saying that they are losing so much without investment into it. So if you stop thinking about investing and you stop thinking about like stopping the money draining out. When I had my 2 kids, I had 2 natural home births, right? Which were at home with an independent midwife that I paid for, right? The best money I've ever spent in my life, less than a holiday, for all of my antenatal, postnatal, and births, 2 beautiful births in candlelight at home in water. I was very lucky. I was very lucky, but I did a lot of prep for that. People think I am insane. Because why would you pay for a birth with an amazing outcome at home when you could get it free on the NHS? And the NHS, because I did have to go in because they wouldn't. Long story, but I'm O negative. My kids are A positive, so I had to go in and get the rhesus thing. I was treated like a leper when I took my 1-day-old baby into the NHS hospital for their injection, because I wasn't in the NHS system, not as somebody who'd saved the NHS a shitload of money by having births outside. So I think we just need to get real. Like the money, the organizations are already spending money on this, right? It's not an investment, it's stopping a loss, right? And actually we all need to get real about actually paying for healthcare, because do you know what? It is not free.
Yeah, I like that. I like that way of looking at it. It's not. I mean, we do it anyway, right, in this industry, but it's not investing, it's stopping the cost.
Yes, but that's a different way of thinking. I find that more helpful when talking to senior leaders and to boards, because it becomes less about you've got to go and find money in a time of scarcity, although when isn't it a time of scarcity? It becomes actually you would not let this amount of money drift out of your organization on anything else. So why are you doing it within healthcare?
Yeah, and it's crazy, right? Like coming from my personal training background, moving into this and understanding the costs that companies are losing through well-being and then retention because of well-being, you're like, this is just bonkers how much money companies are losing. And you're just like, okay.
Yes, but also organisations don't often measure that. And what has not helped is these massive reports with the 1 in 4 and the X trillion this and the 15 billion this, because that, whilst possibly true, I mean, if you look at the longitudinal research behind it, then sometimes it's questionable. But that is so pie in the sky that actually, how does that relate to me and my organisation now? Yeah. It's like us hearing that, the world's going to implode or burn to death in 20 years, but we're all getting on planes and going abroad this summer, right? It's like it's so big that you can't actually relate it to you and your situation. Yeah. And it's also not helped because health and mental health has always, in 20 years, been incredibly difficult to get an ROI on. So everybody's trying to sell their services to an organization is saying that their particular piece of the jigsaw is going to do X, Y, and Z, which it won't because it's part of an overall thing.
Yeah. I'm loving learning all this stuff, Amy. You're fantastic. I knew this was going to be like this.
Thank you.
I have one more bit before I challenge you to your top 3 take-homes.
Okay.
I mean, probably one before I read this, and I thought you were more mental health strategy. Learning this, so it's definitely more around health.
Really, I guess coming up with a psychiatrist as a father, it was always going to be more mental illness, but both,
Yeah, exactly.
I'm a yoga teacher, Richard. We do our health bit as well.
Exactly, right? It's basically me.
Well, exactly you, just with slightly longer and greyer hair, right?
So now, I mean, mental health strategy, I mean, and you've probably covered this within this organization, but what we need to improve, but what can you do? What's the quick wins in regards to mental health strategy?
Well, a quick win would be questioning why you're doing it in the first place. I mean, I know that's not particularly politically correct to say right now because mental health has been so huge, but I always question organizations as to why are you doing this? Like if you're not going to do it properly, or you're not going to put money into it, or you're not going to invest in this, why are you doing it? And at the moment, there's no real legal requirement apart from what I said to you about managing people with chronic illness. So I think that's the first question. I think a lot of organizations do stuff because everybody else is doing it. And actually, I mean, when I work with organizations, we're looking at their specific organization and what they need and what they're trying to achieve, and what the problem is. So, and that's the key thing in the first place, right? Is I've worked with organizations who've said, look, we just want to make sure our staff feel cuddled a couple of times a year. Great, I can work with that. Working with an organization now that has a big suicide problem. Great, we can work with that. Working with organizations that know that specific parts of them and call centers have high levels of mental health related absence. Great, we can work with that. That's like helpful, but that's part of number one is being really clear. And also being really clear. I mean, we're moving into a way where, like I said, global benchmarks and psychosocial risk assessments and regulations are creeping in, right? And you can make the argument that the health and safety executive had a legal requirement to check on risk assessments since for 20 years. It's not really been enforced. But I think it's being really clear what you're doing and why, and what you're prepared to commit to that. Because when I speak to organizations that want to reduce absence, and yet they've got a junior level HR person with a budget of 0, it's just like, why even do that? Kind of like, what are you trying to achieve here?
Yeah, exactly. Because you haven't figured out, as you said, that why are you doing it? I think that's
the point. I think it's a big, honest question for us all in the why and the what, because to make change takes a lot of time and energy. I mean, you can see that at a global level with climate change, right? So to make organizational change, you can do it, but there's no point doing it. And if you're not going to give people in it the power or the money to do it properly, or the support from a senior level,
So I understand that. Can I challenge you slightly? I mean, not a challenge really, but just thinking from a different angle. So I get that within a large organization, I understand how you can take time to do that. In a smaller organization, let's say middle size, like between 100 to 500 people, how are you then getting them to think about this as a time, like it's a slow process?
They're the easiest, right? So SMEs are easier than large organizations. Large organizations, it's like trying to change the Titanic, of course, and it's totally siloed. SMEs can be easier. If you get the right person on the senior board in board, or you get the right senior leadership, you can make change a lot quicker, right? So because of the size of the organization, you're not right. I think the point that people miss about workplaces, and I had a client earlier this year who we kept having the same conversation. And I realized what it was, right? So this was an organization that did a lot of the medical evaluation of drugs and things. So they were all brainiacs in kind of like, numbers and risk and this and that and stuff. And they kept saying, well, we just want an intervention when someone's burning out. And I said, well, I don't think that's the right approach. I think you need to do prevention as well. And we kept getting stuck there. And then I realized that these are people that work in the health service or work within the health service. And our health service is all about you go when you're ill, right? Primary care, GP, A&E, you go when you're ill, right? Because public health campaigns don't really work, right? That's societal level. But an organization is a fascinating thing, a workplace, because it's a controlled environment. You can control how many people are in it. And through measurement and performance management, you can control behavior, right? But also, if you think of it as a small organism as opposed to society, you can change people's health and mental health behavior through teaching, through skills. It's not like a public health campaign where you're changing the public health of a nation. You've got that ability within an organization to do that. And when we showed that at Ernst & Young, we were able to show that within 2-3 years of pumping out this quarterly program of health and mental health, our health screening data changed against an industry backdrop of peers that had regressed. So that was super exciting because you can't fake cholesterol levels or blood glucose or this or that, right? So the point I'm making about this is that you have, whether you're small or large, but smaller it's easier, an organization where you've got controlled environment, people have to go to lunch and learns, you're training people, you're managing people's behavior through how you measure them at the end of the year and what your policies are. So you have this ability to build up a prevention, but you have this ability to intervene earlier and to manage. That is the fascinating difference between workplace, I think, and societal NHS stuff, is that we can do that. You just have to think through the structure and what you're trying to achieve. And when I write strategies, they tend to have prevention, which is split into two. It's the psychosocial risk, how do you stop workplaces making people unwell? But it's also the how do we teach Richard and Amy how to look after themselves better and to make positive life changes and life choices, both in terms of education, but in sort of nudges. Then you've got what you do when people are starting to become unwell, how you intervene, what your policies are, where occupational health sits, how line managers fit. And then you've got the when people are off sick and how you manage them back. So I tend to think in those three boxes, and then you put your interventions and organizational enablers under those. But whilst remembering that that first box of prevention is a lot easier to do because it's a controlled environment that you can change people's behavior. Was that a long ramble, or did it make any sense?
I love it. Makes so much sense. It's so interesting. I was thinking all the way through this. I'm like, we've got quite a lot of people on here. If they're still on here, this is some gold information for them to take away. Thank you for sharing. We are nearly there, and so I will ask you the very last question. I always ask this to every single person.
Okay.
What are your top 3 take-home bits of advice from what we've spoken about for people to utilize and make use of for going forward?
I think this is not. I think It's actually okay to do nothing. Right? I know that sounds a funny thing to say, but we are human beings, not human doings. And from an organizational point of view, I think it's actually quite useful sometimes to sit and take stock and think through what you're doing and why. So like I always suggest to organizations that they take time out to stop and think about what they're doing and what's working, and then make a decision from then on. But it's actually okay to not do anything on health, mental health and well-being right now. Is that, I mean, I know that sounds kind of slightly counterintuitive, but actually sometimes plowing into, like, it's a lot easier to put some thought in up front than to unpick later. And I spend a lot of time unpicking things like really poorly thought through mental health first aider programs and things like that. So my first would be like, it's okay to do nothing and challenge what you're doing and why. The second would be stop thinking well-being and start thinking about health and mental health, both in your own behaviors, in your organization, but also just, I think a bit of thought on the psychology of health and mental health is a really useful one, because I think that's where this is going, right? And I know, like, it's summer. I'm just saying it's summer. I'm looking at it's absolutely honking it down in London. So I think, is it summer? But I think, okay, so this is a bit of life dinosaur experience. I'm 43 and I have a 5-year-old and a 9-year-old, right? And I look at people in our industry who I think are doing way better than me, who are writing books and doing TED Talks and all over social media and stuff. And I'm thinking, wow, right? These people are so much, more productive, faster, blah, blah, better than me, right? And I think that's really unhelpful as well. So, I mean, it comes down to the first point, do nothing. It's about stop comparing yourself, and also challenging whether you as an individual or as an organization are doing stuff that's right for you at the right speed for you. Right. So, I have a 5-year-old and a 9-year-old that I actually want to see grow up. My dreams of being Richard Branson sort of died at the age of 27. So, kind of, I love working. I love what I do. I love seeing my kids. I love going and swimming in the sea with Sarah, and I like hanging out with people. So it's sort of like actually being really honest as to building the right program for your organization at the right time, and not comparing yourself to every other organization. And that comes for individuals as well in terms of well-being, right? We live in this too fast world right now where everything's about performance and having done stuff and growing and getting this done and stuff and comparison. And actually, I don't think that's helpful, because that's the complete antithesis of health and mental health, right?
Yeah. Completely agree. I think that's where I was going earlier on with the Australia comparison.
Although you're talking about, I better not insult any cricketers or I just have, but it's kind of like it's about what does it mean to win, right? By Sarah. It's like, what does it mean? But also, like I said, I'm comparing myself, and I do it sometimes to people in our industry who seem to be everywhere writing every book. Yeah. And then I'm like, actually, they don't have dependence. Like, you can achieve everything over the course of a lifetime, but it's like you can't do everything all at the same time. Yeah. And that's what I mean by the health, mental health, and well-being. If your organizational strategic priorities at the moment are to stay in business, then actually, maybe focus on that and do this a bit more slowly, right?
Amen to that.
Or look at how this is affecting you staying in business. And if you've got lots of employees that are off, then actually maybe managing absence better is a first step before plowing into well-being.
Yeah, I love this. Thank you ever so much.
That's right.
I could do this probably every month. I think it'd be so much more information to give people, but that would cost me lots of money, and I can't afford to get everyone here every single time. If you do want to reach out to Amy, where do we find you?
LinkedIn. So LinkedIn is a really useful place. I do a lot of feedback on there, but also on LinkedIn, you can put it's got my newsletter. So the best way to find out what I'm up to is on that. But everything, sign up to newsletter and follow me on LinkedIn.
And I'm on that newsletter.
Great.
Thank you ever so much. Please reach out to both of us if you want to chat. We are both providers, so the more people we work with, the better for both of us. The more our businesses can survive. Anyway, that's our shameful plug. The next Wellbeing chat is in September. Once with you, it's not completely organised yet. But yeah, it was good to see you all. Have a lovely summer, if you can call this summer. And we will speak to you soon. Amy, obviously stay there. I'm going to chat to your office.
I will do. Cool.
Hi, everyone.
Bye, everyone. Have a great summer.